Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about a condition that quietly affects millions, osteopenia. It's more likely in women. 45 million American women have been told that they have osteopenia, whereas only 5% of the population of men get told. If unchecked, it could lead to the serious consequences of osteoporosis, which includes fractures and disability. But there's good news. We know a lot about it, and today we're going to be looking at cutting-edge treatments, regenerative medicine, and if you have been diagnosed with osteopenia, how we can reverse it back to normal. Joining me today is Dr. Bryn Henderson, a board-certified physician with years of experience using advanced patient-centered therapies to promote healing and restore wellness. Dr. Henderson, thank you for being with us today.
Well, you're welcome, and thank you for having me.
So let's start with the basics. What is osteopenia?
Osteopenia means your bones are getting thinner and weaker. Think of it as a yellow light before the red light. It's not as dangerous, but it's a sign to take action before bones become too fragile and break easier.
Well, as I mentioned, 45 million women in America this year probably got that diagnosis in their office, whereas only 5% of men. Obviously, we know it comes after menopause, usually the age of 50 and up, because estrogen, which helps protect the bones, starts dropping. Let's talk about who the candidates are that are going to probably get osteopenia before others.
People who are very thin and don't get enough calcium or vitamin D, who smoke or drink heavily, are also at high risk. Genetics play a big role. And I want to mention a research study I worked on in Arizona. We found that a surprising number of elite female athletes, especially those with low body fat and no regular menstrual cycles, had osteopenia. Their hormones were so off balance that despite being strong on the outside, their bones were brittle on the inside.
All right, so this is a dilemma. How can it be that they tell people to do physical exercise to strengthen their bones and avoid osteopenia and osteoporosis, and now you're coming back and telling me that these very athletes have it?
Here's the deal. It's the balance. So those women, these athletes, don't have menstrual cycles. Their estrogen's so low because they have no extra fat. So that makes them sit and duck for weak bones. It's just like the women that are treated with the steroids. If there's too much steroids, that screws up the estrogen balance, and they have weak bones. I was part of that study. I'm telling you, these ladies were athletes. We had a mobile DEXA.
Well, the good news is that in most medical clinics and doctors' offices, they're ordering, and it's being paid for by insurance to have a DEXA scan or a bone density scan.
That's true. What are we talking about is sometimes people don't find out after a small fall or a sprain raises their concerns because they end up with a fracture. The case we studied had a patient had back pain and sprained her wrist in a minor fall. Those were her warning signs. Her bones were already weak, so osteopenia was there.
So what is this DEXA scan?
Oh, a DEXA scan measures the bone density and gives us a score. It's called a T-score. If the T-score is between -1 and -2.5, it means osteopenia. We'll also check vitamin D, calcium, and other markers to rule out underlying causes like hormone imbalances or nutritional deficits.
All right, so what are the main causes of osteopenia? What are these women doing or these men doing that is causing this osteopenia?
Well, I'm sure the biggest cause or the most common is aging. We naturally lose bones as we get older. But things like poor nutrition, low physical activity, or long-term steroid use, and many medical conditions like thyroid problems can speed it up. And women lose bone faster after menopause and because their estrogen changes.
All right. So you mentioned thyroid. That is very fascinating to me. Talk about the thyroid problem that would cause someone to lose bone faster.
Thyroid is like the thermostat of the home. It tells us the metabolism of the body. So if you're going to have a low thyroid, you're going to have a slow metabolism.
So tell me, how does the thyroid affect bone to become osteopenia?
Okay, so hyperthyroid in particular can accelerate the bone turnover. That leads to an increased bone loss and potentially increasing the risk of fractures. Hypothyroid, the opposite, impact on bone health is less clear, but some studies suggest it may also negatively affect bone density because of the change in metabolism.
Okay, so usually when a person comes in for their annual physical checkup, we do check the thyroid, and that could be checked. So we don't have to worry about that. So now we have a T score of -1 to -2.5. We're diagnosed with osteopenia. How do we treat it?
It starts with the lifestyle. Weight-bearing exercises are essential. Walk, light weightlifting, both strengthen bones. A healthy diet with calcium and vitamin D is essential. And if the bone loss is more serious, or if there's a high fracture risk, we might even start you on medications called bisphosphonates.
All right, so we know at this point in research in medicine, we have 94 minerals and trace minerals that have been identified. Not to say that medical researchers are going to find more in the future that haven't even been discovered. But so far, I would like you to tell us maybe the top that people are aware of, that it's not just calcium and vitamin D. What are the other essential minerals that you could recommend that will help with bone growth?
Okay, calcium and vitamin D being the most well-known. Other essential minerals include magnesium, phosphorus, zinc, and boron. Adequate intake of these minerals, combined with vitamin K and other nutrients, contribute to strong and healthier bones.
Okay. So it's not just calcium. What I suggest to my patients is so easy and so inexpensive. You can go to a health food store and buy a bottle of minerals and trace minerals and take a half a teaspoon a day, and you're getting all the minerals and trace minerals you need. You don't even have to swallow a pill. It's liquid. It's like $7. So let's talk about a patient that you had and how you treated her osteopenia.
Okay, that's good. She was very active and wanted to avoid medications. So we added regenerative therapies. We started with some platelet-rich plasma, and those injections, which come from her blood components, have no side effects, stimulated the bone healing.
Where did you put it in?
In her case, it was on the large bones because that's the bones that were getting weaker. Those blood components stimulate the bone healing, and you can easily get peptides, so that would help. She also received IVs on a regular basis of nutrients to replenish the things like magnesium, vitamin D, and the antioxidants that she didn't get enough of.
All right. And what improvements did she experience?
Well, that's a good question. In 3 months, her bone density scores improved. Her back pain was much better, and she had more energy, a lot more. At 6 months, her scan looked even better, and no new falls, no fractures, and she felt much stronger and more confident in her body, which was fantastic.
So you're stating that we can reverse osteopenia. Do I have a yes?
Yes.
All right. So now let's go to genetic links. Can you explain, is there a genetic link to osteopenia?
Definitely. Up to 80% of your bone strength is inherited. Some people are born with genetic variants that affect how well their bones develop or hold on to calcium. In her case, a family history of osteoporosis likely increased her risk, even though she looked perfectly healthy.
All right, what about problems during pregnancy or early life, or even when the baby is developing in the womb?
Yes, even the womb matters because if the baby doesn't get enough nutrients, like calcium and vitamin D during the pregnancy, or if the mother has health issues, it can result in lower bone density as the child grows. That's why building strong bones needs to be started early, even before birth.
All right, you always talk about traditional Chinese medicine. What role can that play, and how can one introduce traditional Chinese medicine into their life?
Traditional Chinese medicine addresses osteopenia like all others because it's viewed as an imbalance. Kidney energy is out of whack or out of balance, and they create acupuncture points and herbal therapies to focus on restoring the balance of the body through energy and improving circulation to the bones. We often use points along the kidney and bladder meridians to support this bone regeneration.
You mentioned IV therapy earlier. Why is that important?
Great question. Bones don't grow without right materials. IV therapies give the body immediate access. You bypass the gut, so nothing's broken down. It drives right into the vein, and the key nutrients like magnesium, vitamin D, zinc, and antioxidants are immediately available to the body to support bone formation, reduce inflammation, and improve overall energy and recovery.
So, if our viewers want to learn more or have concerns about it, where would you think that they could do a little research on their own?
You can research bone health at the Bone Health and Osteoporosis Foundation, the leading authority on bone health, and has tons of resources. Their website is www.bonehealthandosteoporosis.org. Whether you're newly diagnosed or just curious about your risk, it's a great place to start.
All righty. Well, let's do our famous mnemonic that you teach your patients. What do you recommend?
Well, we use a mnemonic called Bone Safe. It's a daily plan.
All right. What does B stand for?
Build strength and exercise. Do weight bearing and resistant exercises like walking, dancing, and weightlifting.
O.
Optimize calcium and vitamin D. Get enough from your diet, supplements, and safe sun exposure.
N.
No smoking or excess alcohol. Both weaken bones and raise fracture risk.
E.
Evaluate your bone density. Regular DEXA scans help monitor your bone strength.
S.
Screen for medical causes. Identify thyroid issues, long-term medicines, or hormonal imbalances.
A.
Adjust your fall risk. Install handrails, non-slip mats, and ensure good lighting at home.
F.
Follow a balanced diet. Include leafy greens, dairy, or fortified foods, and avoid high-sodium items.
E.
Engage with your doctor. Discuss treatments, supplements, and a tailored lifestyle to bring about a proactive treatment plan.
Well, thank you, Dr. Henderson, for such an enlightening conversation. Osteopenia may not always make headlines, but it affects so many lives, quietly weakening our foundation, our skeleton, if we're not paying attention. If you're watching and wondering if you or someone you love might be at risk, this is your sign to take that next step. Get screened. And I will tell you, it is part of most annual physical workups for women over 50. We do the bone scans. It comes to me, and I do have to tell you just something funny. People don't understand how on the other end of it, when I get a bone scan, and it will tell the bone age of the patient. So let's say the patient is 70, and I go, oh, your femur is only 58 years old. Or the reverse can happen. They say, oh, you're 50. I'm sorry to tell you, your humerus is 80. And I'm sorry, I'm not laughing at the patient or laughing at their calamity. I'm laughing at that I get to see the age of the bone. And I don't know, it's kind of fun.
Well, it's often different than the
Yeah. So anyway, get screened. Make sure you support your body for the long haul. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.